Hello, my name's Bev Kennedy and I'm a board member of Westgate Health Co-operative. I'm delighted to welcome you to the Community Mental Health Forum on Anxiety and Depression in a Global Pandemic. I would like to open this forum by acknowledging the traditional owners of the many lands which we meet today, who sustained healthy communities and wisely managed these lands for thousands of years. We pay respect to the elders, past, present and emerging, as we at Westgate Health remain committed to shaping a future in which all thrive. I would also like to extend a warm welcome to any First Nations people who are joining the forum this evening. Westgate Health has a long, proud history as a non-for-profit, member-owned cooperative that provides excellent, affordable health services to its members. Located in South Kingsville and Newport, we've been around here for 40 years. We provide GP and allied health services in a caring, compassionate, patient-centred setting. As a non-for-profit, all our profits go back into caring for the community. As a non-for-profit cooperative, we're the voice of a community and a leader when it comes to primary health. Last year, we received a generous grant from Westgate Neighbourhood Fund to run these series of community mental health forums. Our last forum focused on the impact of pandemic on adolescent mental health in a global pandemic. Tonight, we are talking about something that's probably close to all of us in one way or another, and that is the impact of anxiety and depression on us in a global pandemic. We're incredibly grateful to the Westgate Neighbourhood Fund for their generous donation which made it all possible, and thank Minister Melissa Horne for her ongoing interest and support for our cooperative and this program. We're delighted to have Dr. Ben Chia as our facilitator. I would like to welcome our panellists, who Ben will introduce, and you, our guests, both in-house and online. Please note this forum is recorded and will be used as a future resource for Westgate Health Co-operative. This forum is for you, the attendees, so we really encourage you to ask your questions today in person, via raising your hand or scanning the QR code that will be displayed on the projector, or if you're online, via the Q&A function on the right-hand side of your screen. And we'll ask the questions during the panel discussion. Some housekeeping. If you're watching us online and you're having any technical difficulties, please refresh your page, or you can chat to our events team via the tech support button at the bottom right hand of your screen. The location of the toilets, the bathrooms for the in-person attendees are left to the into the hallway and left again. The emergency exits are located at the back of the room or through the way that you entered the forum tonight. Thank you so much for attending. I hope you feel welcome and take away information and inspiration that will benefit you and your community as we all seek to increase community health and well-being. Let's now listen to a message from Melissa Horne, MP, and then a little more about Westgate Health Co-operative and these forums.
Hi, my name is Melissa Horne. I'm the State Member for Williamstown. It's terrific to be able to support Westgate Health Cooperative's community health forums. They've been recipients of Westgate Tunnel Partnership Program grants, and they're doing a series of mental health forums focusing on people's mental health in a global pandemic. They're being held out of Spotswood Kingsville RSL, which is a great partnership in itself. So I'd really like to commend everyone who's been involved to get these important forums up and running, and encourage anyone who would like to participate in it.
Westgate Health Co-operative is a not-for-profit community health organisation that's been around for around 40 years. The project that we're about to launch into is a community mental health project, and we see this as an opportunity to meet the needs of many people in the community by empowering them to find their own way through the mental health system.
Mental health has always been a common theme for GPs in terms of people who they're dealing with. During the pandemic, all the mental health problems that people have had have got greater and more intense, and what can we do to help people to find their way through this, to be able to access resources that are there, and to do this in a community collaborative way of itself is bringing people together, and some of that networking, some of that people working together, problem solving together is of itself going to be helping people find their way through this.
We're a really diverse community, and it's an opportunity for people to have their needs met where they're at, and that's what we see as being hugely beneficial, because that's it's not one size fits all, and that's a challenge for our GPs as they work their way or guide people through the system as to what's best going to meet their needs.
So we couldn't have done this without the funding, and we're just so thrilled that we actually are now being able to get funding that we can put this program on, run face-to-face sessions for the community. It's a game changer for us. We just simply would not be here having this conversation if it had not been for the grant that we received from Westgate Neighbourhood Fund.
Welcome everyone, and welcome to those people that are here with us at Spotswood RSL, and also all of our attendees online. We're here to have a discussion about depression and anxiety, and some of that discussion will be around the effect of the COVID-19 pandemic on these experiences. I'm just going to do a brief introduction, and then we'll get into the speakers and then the panel discussion. I think it's important to acknowledge that, firstly, that depression and anxiety are not just what I would say are disorders, but they can be also normal human experiences. In terms of anxiety, it's actually an adaptive function. For example, when you were thousands of years ago, if you weren't anxious about predators, then you would die. You would get eaten by a lion, or so that's a normal anxiety. In contrast, if you're sort of anxious about, for example, touching a doorknob, which happens in people that have obsessive compulsive disorder, which is an anxiety disorder, then that becomes a problem for you, and that's anxiety that's out of proportion to the threat. I think the word depression can describe many different internal emotional states. The first one that people often think about, I think, is sadness, but I think that sadness often isn't about anything. I think that's one of the misconceptions that people have when they struggle to understand depression, is that they think that they must be sad about something. Of course, there's going to be reasons for that depression, but it's not necessarily something that they're sad in that moment about. Depression, some ways that people describe it can be feeling an intense heaviness, feeling low or empty, and a lot of these descriptions are very hard to imagine if you haven't experienced it yourself. One thing that I think is pretty much common in people that describe suffering from depression is a lack of enjoyment in things that they used to find enjoyable. And it can often extend to more kind of existential thoughts about not seeing a point to being alive, not having anything to look forward to. It can be really intense suffering. But on the other hand, it can also be a normal temporary reaction to life events, such as losing a loved one. And I think with the pandemic that was common, because it was a big loss of certain things in people's lives, or being disconnected from community or loved ones. and when it's prolonged and affecting someone's ability to function, then I really think that going to see your GP is a really good first step. Both because physical problems can actually cause depression. So, for example, if you have a problem with your thyroid, if that's functioning at a low level, that can make you feel depressed, and if that's corrected, then you may not have an underlying depression. Your GP may also be able to manage depression if it's mild, and if required, they can refer you on to appropriate mental health professionals. And then I think that brings us to the challenge then of finding someone that's tailored to your problem and to your personality, because I think that's really the hardest thing I mean, what I do is that I get to know psychologists in the local area, get to know what their interests are and what kind of people they would suit working with. And then when I do an assessment of a patient, I can really tailor that selection of therapists to that patient. Whereas I think it's a lot harder for GPs and other referrers to sort of get that kind of knowledge. So I think it's a real challenge, and that's part of maybe what we'll discuss tonight. And that's why I've chosen Olivia, who's a former GP and now is a trainee psychiatrist, who can give us an insight into the challenges of managing these presentations as a GP. And also Michelle, who's worked in many different parts of the mental health system and now owns her own psychology practice. So she's got unique insight into choosing, I think, the appropriate clinician for particular patients. So combined with me as a psychiatrist, I think we've got a good variety of people here that we can have a really good discussion. So it'd be great if you attendees put your questions in Slido, or people that are here that can put their hand up and ask questions in person. So with that, I'd like to introduce our first speaker, Dr. Olivia Rimington, who's, as I said previously, a GP and now is a psychiatry registrar at St Vincent's Hospital. Olivia graduated from Monash University in 2002 and completed her general practice training in 2011. She's always had a special interest in mental health and well-being, but after witnessing the devastating impact that the COVID pandemic had on the mental health of her patients, she made the decision to leave general practice and has recently commenced training to become a psychiatrist. She's looking forward to returning to the western suburbs to practice psychiatry once she's finished her training. Thanks, Olivia.
Thanks, Ben, and I'd just like to thank the Westgate Health Co-op for the opportunity to come and speak tonight to a topic that is very dear to my heart. So I'm just going to take you through a GP's perspective of anxiety and depression and the particular challenges that came up during the COVID pandemic. So hopefully that's worked there. Yes, can use the laptop. There we go. First job done. So just to give you a bit of background in terms of what mental health in general practice looked like prior to COVID, that the mental health presentations have been just continuing to increase over the last 10 to 20 years. And we know that the pandemic caused a vast increase in these presentations. Prior to the pandemic, 2 out of 3 consultations to most GPs would involve mental health. I would say that for the adult patients that I saw, that went up to practically 100% during the pandemic. And one of the things that became very apparent is that current services are just not able to meet the demand that's there. And that means that at the time that I left working general practice at the end of 2020, the waiting list for mental health care was exploding. Okay. So I thought what I would do is introduce you to Jenny. So Jenny is a fictional patient, so I'm not breaking any confidentiality, but it's basically to give you a feel of the kind of things that I was seeing during my work as a GP. So this was a telehealth consultation. hadn't met Jenny face to face. She was a 43-year-old mother of 3 who was working from home while trying to balance, and apologies if this is bringing back bad memories to anybody who went through it, but trying to homeschool her 3 children whilst working from home. Her husband was an essential worker, so he actually got to leave the house to go to work. And she made the appointment because she just was feeling tired all the time, not sleeping. She'd noticed she was gaining weight. She was feeling very irritable and short-tempered. She had poor concentration, and she just really wasn't feeling herself, and thought that she should probably just wanted to come and check that, it wasn't anything serious, and just wanting to have things checked out. So the first thing that's kind of running through my head when I'm sort of initially kind of taking a history like this is I start thinking about, as Ben said, is there an underlying medical problem that's going on? Because there's a lot of things that can cause those sort of symptoms, and particularly in a GP sitting, you're thinking about things like anemia, iron deficiency, underactive thyroid, diabetes. As a GP, I'm always trying not to miss any of the big things that could potentially be very serious. So I'm thinking about cancer, I'm thinking about all of those things. But at the back of my mind, I'm sort of thinking, is there some anxiety or maybe depression that's going on here as well? And you can have both. You can have an underactive thyroid and also be depressed for other reasons. So it's sort of thinking about all of that. And, the other thing that's also going through my mind is that, this all feels like very normal responses to have to a very abnormal situation that we're in. And it's probably a combination of all of these factors. So the first thing I'm doing in that consultation is I'm trying to just run through all of the major systems, bowels, heart, respiratory, women's health, cervical screening, is that up to date? I think that was something that was a big challenge during COVID when we couldn't see people face to face. Is there a strong family history of cancer that I need to know about and be, more aware of other things to look for? And so going through all of that, and then my first step is usually to just start off with getting some blood tests done. So checking the sort of the essentials, a blood count, looking for anemia, infection, signs of anything nasty like an underlying blood disorder, checking iron, B12, folate, things that can make people anemic and tired. Checking the thyroid, always just like to know what's going on with the liver and the kidneys, screening for diabetes, checking vitamin D, cholesterol, and then I ask people to make a follow-up appointment, but I ask them to make it a longer appointment because I know that I need to discuss the results, but then get a bit more into what's been going on. So Jenny made an appointment 2 weeks later. We went through everything. Pleasingly, everything looked normal, except the one thing that was abnormal was gamma-GT, and that's the liver enzyme that breaks down alcohol. So already before starting the consultation, it just kind of gives me a bit of an idea of maybe where to sort of head things. And further discussion and going through all of those results revealed that just Jenny really wasn't coping at home. And actually, the more we talked, she was feeling really anxious and worried most of the time. And that was really affecting her ability to go to sleep and her mood as well. And yes, her alcohol use had really crept up during COVID, and it had gotten up to a bottle of wine or more a night that she was mostly drinking on her own, and really getting to that kind of 5 o'clock, like, is it 5 o'clock yet? Is it time to sort of pour that first glass of wine, which she acknowledged wasn't healthy, but also felt like it's just what she needed to do. She wasn't really reaching out to friends. She wasn't wanting to join any kind of online sort of, social activities. She wasn't, going out and really exercising and having her allotted hour of exercise. She just didn't have the energy, just couldn't be bothered to do it. She was snapping at the kids, at her husband, but there was this feeling of just feeling really guilty. I shouldn't be feeling like this because so many people have it worse than me. I've got a roof over my head, I've got a job, I can work. I shouldn't be feeling like this because other people have it far worse. And just starting to report, just feeling really overwhelmed. It was like, it'd just be really nice to go to sleep and not wake up, just to kind of sleep through it all, which just, starts to get me concerned that there's something more that's going on. So what I'm starting to think there is, is Jenny actually depressed? Is she anxious? Is it both? Is it neither? And is this just a normal reaction to a very abnormal situation? I think what COVID did is kind of created this perfect storm for the development of depression and anxiety, and Ben sort of made reference to that before. You know, we were all dealing with multiple losses, the loss of our kids being able to go to school, having to work from home, or, you know, losing our jobs completely. So the financial losses that involved, the social losses, all of the events that didn't happen, the things that were cancelled, and the loss of a lot of our healthy coping mechanisms. I'm a big fan of retail therapy. High Point was closed, you know. Going to the movies, going out for dinner, being able to exercise in a group, to go somewhere for as long as you wanted to go walking in the bush. You know, if it wasn't in your 5Ks, you couldn't go there or do that. And then I think a lot of us turn to those more unhealthy mechanisms to cope. And, you know, alcohol's right there. Dan Murphy's did really well during the pandemic. And, you know, all of those comfort foods, you know, your sugary, fatty, you know, things that feel good in the moment probably don't feel too good, you know, the more we keep on indulging in them. You know, there was that increased stress at home and at work. I don't even want to go there with homeschooling, but if you went through it, you'll know what I mean. And I think the other thing was this constant fear of the unknown. You know, what's going to happen? What is this COVID, and what's it going to mean if the lockdown doesn't work or the cases go up? And just that loss of control over our daily lives, and that being in a chronic state of high alert, and the impact that those stress hormones, our adrenaline and cortisol, have on our body, and that the physical symptoms that it can cause. So, you know, I think there's a lot going on. So if you want to sort of take it to, in terms of whether we're going to go ahead and diagnose something, I've just put up here the criteria for a generalised anxiety disorder, which is what, as a doctor, we're sort of looking at to be a bit more objective about whether we think this person has an anxiety disorder. So you can see here, it's, you know, Jenny ticks a lot of those boxes about the excessive anxiety and worry most days, about numerous events and activities, trouble controlling the worry, and presenting with, you know, 3 out of those 6. So it's the fatigue, the poor concentration, all of those symptoms. And then if we're looking at the criteria for a major depressive episode, you know, I think you could say, based on those discussions, you probably could diagnose Jenny with a major depressive disorder. You know, she's reporting a depressed mood most of the day. You know, she's lost interest or pleasure in things that she would normally enjoy. She can't even do them, you know, during the pandemic, and all of these other things. You know, often you'll see a decrease in appetite and weight loss, but for some people it can be the other way. They're just mindlessly eating and will gain weight. That impact on sleeping, just feeling either agitated and kind of needing to move and do things, or just not wanting to do anything. And again, the fatigue. And then the more concerning things of when people start feeling really worthless and guilty for feeling the way that they're feeling, not able to concentrate and starting to have thoughts of death. So if you take all of that into account, then the next thing I have to work through is actually making a mental health diagnosis of anxiety or depression. Is that going to be helpful for Jenny? Okay, because it really depends. And that's where, in general practice, if you have the privilege of getting to know your patients and they see you regularly, you can start to get a feel for, well, how's my patient going to handle having this discussion about, you know, that I think a lot of your problems are related to your mental health. And, you know, it's this idea of meeting people where they are. And it's hard with a new patient if you don't really have a sense of that. But I always feel, so if you look at the pros, you know, that it can help give someone a way to understand what's going on. It can help to remove the guilt and blame that, you know, I actually think you're depressed. It's not just that you know, being lazy or can't be bothered. And then once we kind of know what the problem is, then we know how to start helping. You know, we know what works and what doesn't work. And on a more practical side of things, if I'm wanting to do a mental health care plan for a patient so that they can access a Medicare rebate for seeing a psychologist, I actually need to put a diagnosis on the mental health care plan to be able to make one. And the same with certain medications, antidepressants. I need a diagnosis there so that I can tick the PBS box so that someone gets that medication through the PBS and isn't paying for it privately. So those are some of the pros, but some of the cons can be if someone doesn't sort of have that way of thinking, or they really feel that this is a physical problem and you're trying to say, no, I think you're depressed, it can make them sort of think that they're not being believed because the physical symptoms are real, they feel very real, and it might actually alienate them from coming back to see you, and you might actually put them off getting any help whatsoever. So in terms of Jenny and the conversations that we'd had, felt that it was reasonable to sort of start simple and sort of say, look, it sounds like you might be a bit depressed. And just starting with reassurance and one of the things that I would tell people all the time, like, I don't know about you, but I've never lived through a global pandemic before. There is no right way to respond. There's no way that we should or shouldn't be feeling. We've never done this before. So this idea of shoulding yourself, it's really unhelpful, and it's something to try and let go. We're all just trying to do the best that we can under extraordinarily difficult circumstances. And I think in Victoria, we can all agree that we had it tougher than the rest of the country. The idea of trying to start some self-care that is actually going to be more helpful. And so trying to take that away from, food and alcohol. What are other things that you do that you can see yourself actually enjoying, whether it's just going and, running yourself a bath or sitting outside with your morning coffee, listening to some music, whatever you can do that's actually going to be something that's going to nourish you. And I love this concept. I heard another doctor talking about this and the concept of B- work. And for anyone who's a bit like me, a bit of a perfectionist, a bit obsessive, you want to do everything right, this idea that you've got to give yourself a break and not everything needs to be done at an A+ standard, and that B- work is okay. And if that means during the pandemic your kids don't do their home learning and they're in their pyjamas all day and they're watching whatever on YouTube, you know what, that's okay. Is everyone still alive at the end of the day? Yes, great. So that idea of B- work, just give yourself a bit of a break. The other thing that I'm a very big fan of, I have a special interest in nutrition, and particularly nutrition for mental health, because I believe that there is a lot that we can do with our diet, and I'll talk about that more in the couple of slides I've got coming up. Trying to be out in nature as much as you can within your 5Ks. And mindfulness as well, and I'm not sure that'll probably be talked to a bit later on tonight as well. But it's just that idea that anything to kind of get you out of your head into your body. So washing dishes can be a mindful act if all you're focusing on is that act of washing dishes and the way that the water feels on your hands and the bubbles, and noticing, just how satisfying it can be to have something dirty and make it clean, and, just really be in the moment of what you're doing rather than being caught up with everything that's going on in your head. So if we just sort of think about eating for mental health rather than eating for pleasure or eating for weight loss or eating for any of the other reasons why we eat, if we just think about what our brain actually needs to be operating at its best, to give us the best mental health possible, you need fats. Your brain needs omega-3 and 6 essential fatty acids, and these are fatty acids that are essential that your body can't make on its own, so you need to get them from the diet. And those are all things like your salmon and oily fish, nuts and seeds, or if you're not a big fan of those things, getting yourself a good quality fish oil that contains EPA and DHA. Vegetable and grapeseed oils are another dietary source. Trying to look at using coconut or olive oil for cooking, and avoiding the hydrogenated trans fats, which is sort of the manufactured fats that have been shown to be harmful to health. Protein's another really important thing that I think a lot of people just don't actually eat enough protein. So you want to aim for a minimum of 50 grams a day, and just keeping in mind that that's not 50 grams of meat. You actually need to eat about 200 grams of meat to get around 50 grams of protein. If you're a vegetarian or vegan, then that's a lot more in terms of like eggs and beans and tofu and those sorts of things. The other thing that's really important is your vitamins as well, so particularly your B group vitamins. They're used to make a lot of the neurotransmitters, and so the chemicals in your brain that help with your mood and stress levels and all of those things. So if you're supplementing them, you want to take a B complex. You don't want to supplement just any of these in isolation apart from B12. And there's good evidence out there to show that a B vitamin complex helps with your adrenal glands, neurotransmitters, and can be really effective in managing stress and depression. So, I'm a big fan of recommending a B vitamin supplement, as well as trying to increase your dietary intake. So that's all your whole grains, seeds, lentils, bananas, avocados, even, meat and dairy and your dark green leafy veg. And that's you can be as simple as starting with those sort of things. Vitamin D, I think, everyone pretty much is vitamin D deficient these days, and there is an association with lower vitamin D levels and depression. So that's a simple thing of just trying to get out into the sun for about 15-20 minutes a day, and you just need to expose kind of neck and arms up to the elbows with no sunscreen on. You do need a bit more time in the sun in winter, and that's why I normally recommend a vitamin D supplement, particularly during the winter months. And in terms of just the minerals that are really helpful for mental health, magnesium is needed for relaxation of nerve and muscle cells. And so some of the possible signs of a magnesium deficiency is anxiety, irritability, poor concentration, restless legs, muscle cramps. So again, the sources, it's all the same kind of things. It's real foods, it's whole foods, it's your veggies, your whole grains. And you want to aim to get about 300 to 400 milligrams a day. If you can't get that through your diet, then you can get over-the-counter magnesium supplements. Magnesium's best absorbed through the skin, so it's a great excuse to have an Epsom salts bath and absorb it that way. Or you can buy spray magnesium from health food stores, so that's another option as well. And calcium, so it's needed for healthy bones, nerves and muscles. So again, you can get that in supplement form or from your diet as well, so dairy, tofu, your leafy greens. So, having gone through all of that with Jenny, so we've talked through all of that, and we've agreed that she's going to go home, try some of those lifestyle things. She's keen to try and just sort of do this on her own, and then she's going to check back in with me. But she comes back a month later. She missed her 2-week follow-up appointment, but she did come back a month later to say that actually she's feeling a lot worse. And, she thought all of the things we talked about was fantastic, but she hasn't done any of it because she hasn't had the energy. She's feeling too tired. She's really struggling at work. Her performance at work's really been affected. She's tried to cut down alcohol without very much success. And the depression, that feeling flat, is getting worse, and she's really starting to have thoughts of just not wanting to be here anymore. It really just feels too much, to the point where her husband's worried and really encouraged her to come and make a follow-up appointment. And Jenny recognises that, you know what, I think this is bigger than me. I think I need to talk to someone and need some help. So in terms of the next steps of where to go to from here, that's when I start discussing about the options. And particularly we know that if you have mild to moderate depression, as well as all the lifestyle things that I talked about, that support therapy, support with a psychologist is really important. And there's lots of different types of therapy. I think the most important thing, and Ben sort of mentioned that before, is that you find the therapist that's right for you, someone that you feel safe and comfortable with talking to, because you know, all of the evidence shows that that's actually the best thing, the relationship that you have with the therapist. So then that brings up the option of a mental health care plan, which during the pandemic they increased, that you went from getting a Medicare rebate from 10 sessions to 20 sessions. There's the employee assistance program, which a lot of workplaces provide, which gives you 5 sessions with a mental health worker, and some workplaces were actually increasing that during the pandemic as well. There's also Head to Health, which was initially known as Head to Help, and that's a free statewide mental health service that was set up during the pandemic, which provides mental health support. So I've included the numbers there, and then I would always give the numbers for Lifeline and Suicide Line, and bring up the option of medication, which I might leave that discussion maybe until we have our panel discussion. But a lot of the times people will want to try other things first and would prefer to look at therapy first, which is fine, but if someone is more keen on medication, then more than happy to start that too. And then we sort of had the plan to come back and, you know, sort of check in and have regular reviews. So 2 months later, Jenny's doing a lot better. So she started seeing a counsellor through her employee assistance program because she couldn't get in to see a psychologist straight away. And then she was actually able to use that mental health care plan to keep seeing the psychologist she was seeing through the EAP program. She really felt that it was helping a lot. She'd started to actually be able to reduce her alcohol intake and start making some of those lifestyle changes that we talked about. She actually took 2 weeks off work, which was incredibly helpful, and she's looking at taking more time off and reducing her hours. So overall, she feels that her mood is improving, her sleeping's improving, but she is aware that if things go backwards again, that there is the option of medication there, and it's an ongoing discussion, and she's happy to keep coming back for regular kind of reviews and checking in. So if I just give my sort of final thoughts, you know, it goes without saying, yes, the pandemic's had a huge impact on our mental health. I think one of the things that has come out of it is that it's helped to raise awareness, and I think it's really helped to remove some of the stigma surrounding mental health issues, and the importance of seeking help, because I think we've all been so affected by it. There are ongoing issues with accessing mental health support in the community. We've recently had a change in government, and you know, the major parties were both promising to fund increases for mental health and to strengthen Medicare. But I'm not aware that either party was proposing a change to Medicare rebates. And if I can just sort of divert slightly, I think that general practice is really well positioned to provide excellent mental health care to its patients. And I would have loved to have been able to stay a GP and to do that work. The challenge that you have is in accessing Medicare rebates. So if you see a GP for a physical health problem and the consultation goes between 20 to 39 minutes, Medicare will pay you a rebate of $75.75. That's what the government will put in towards receiving that care. If you see your GP for a physical health problem that takes over 40 minutes, then Medicare will pay you $111.50. That's the rebate it will give you. If you see a GP for your mental health for over 20 minutes, the rebate that Medicare will give you is $74.60. They've actually increased it. They used to pay $2 less. So they have increased it slightly, but you can see there's still more of a rebate if you see your GP for a physical health problem than a mental health problem. There is no Medicare item number for seeing your GP for your mental health for a consultation that lasts more than 40 minutes, okay? You can put it through as a physical health problem, but if you do and you get audited by Medicare, it's the GP that has to pay that money back to Medicare, because when you see the GP, you assign your Medicare benefit over to the GP. So I don't know why there's no mental health item number that's over 40 minutes. I'd love to know. I'd love to see that be addressed, because I think that would really help us as GPs to provide better mental health care for our patients. And just finally, I've just got some resources here. The Black Dog Institute and Beyond Blue are both great websites for information, self-assessment, support. In terms of online CBT counselling, This Way Up and Mood Gym are both really great resources. And if you're looking for mindfulness or meditation apps, I recommend Calm and Headspace a lot. And that's everything. So thank you very much.
Thanks so much, Olivia, for that brilliant talk. It's a really great insight into what things were like from a GP's point of view during the pandemic, and I'm sure whoever got to see you during that time really hit the jackpot, because it's clear that you're, that was a really special service that you gave as a GP. So. Now I'd like to introduce our next speaker, Michelle Gopold, who's a clinical psychologist and director of Hobson's Bay Psychology, which is locally here in Altona North. Michelle's a clinical psychologist, a mum, a wife, and an avid doggy supporter. Michelle grew up in the West, and when she graduated as a clinical psychologist, she had a goal and passion to provide the community with psychological services to improve our mental health and challenge the perceived stigma of psychology, where a client is comfortable to say, "I'm looking forward to having a chat with my psych today." Michelle has worked in many mental health roles: public mental health, Headspace. Headspace is the national is it youth mental health, child and adolescent mental health service. Teaching, and currently owns and runs a psychology service, Hobson's Bay Psychology, with her husband, along with 12 other psychologists. Hobson's Bay Psychology gets out into the community, currently providing support to local footy clubs, schools, and aged care facilities. Michelle absolutely loves what she does. The difference her team makes is so important to foster a space where our community can simply come in for a chat. And Michelle is also one of my 3 or 4 go-to psychologists if I really need help with someone. So I'm really looking forward to hearing her talk tonight. Thanks.
Thanks, Ben, and also thank you, Westgate Co-op. I think there's any chance for me to come and talk about wellbeing. It's really, really important. So I thought I'd talk a little bit about anxiety, a little bit about depression, and give you all some insights perhaps that most people don't understand of what anxiety is, how it operates, what depression is, how it actually operates, and especially why the numbers just increased so dramatically during COVID. Before COVID hit, the practice that I wanted to set up, I wanted it to be like a community kind of feel. There were many times where I used to come out for my next client and there'd be 2 or 3 of my clients sitting in the room, and I go, "Oh my gosh, I've double booked." And then they're going, "No, we're not here to see you. We're just come here to have a chat with the person at the front," or "We knew someone else was coming in, so we thought we'd catch up with them after a session." And so it was a really lovely kind of front room waiting space. And then COVID hit, and I remember when lockdown happened, we went in and we had about 200 to 300 phone calls just on that day of what's happening, what do we do, can we still come and see you? Then there was a period of just complete nothing. People were freaking out, I was freaking out. And then gradually, and that then increased quite quickly, we just had an inundation of people needing help. So I hope that what I talk about today can provide some help for you. So firstly, what I want to talk about is emotions, because as a psychologist, I work with what happens on the inside. So I work with emotions, I work with thoughts, I work with your internal experiences. And psychology's come a bit of a way forward. We now have an understanding of the neurology of anxiety, what happens in the brain and the body with emotions. So this graph here is so many silhouettes in the way people experience emotions. It's a study that was conducted about 5 or 6 years ago, where a bunch of researchers wanted to think about, are emotions something that we're born with, as in it's in our brain and it's a biological function, or are we taught about emotions? And so they got about 700 people together They showed different movies, clips, emotion type words, and they got people to highlight where they were feeling activation in their body. And what they found out of those 700 and something people across age, culture, there was a really clinically significant similarity in the way we experience emotions, and that there is actually this part of our brain back here called the limbic system that helps us feel emotions and know what they are. So as you can see here, the lighter colours, the yellow and the red, this is not hot or cold, it's actually how many neurons and activation is firing and happening in your body. The black is a neutral, like not really feeling any emotions, and then the lighter blue you get. So then it's very interesting when you look at depression, there's a deactivation of emotions happening in your body. So what that means then is anxiety is also all in the body. Anxiety is actually not an emotion. Anxiety comes from another part of our in our body, which is the central nervous system. And as Ben was saying, it's an inbuilt survival mechanism, way back in the early days. What anxiety actually lets us know now is when difficult and painful emotions are coming up. So if you can think about when the lockdown happened with COVID, the emotions would have been grief, loss, anger, sadness, guilt. Unfortunately, a lot of the difficult ones. And so anxiety would have been coming up to let us know these emotions are really painful to feel. We don't have our usual coping mechanisms to deal with these emotions, and so anxiety happens in our body. Anxiety is very physical, and the symptoms can vary. Some people really feel anxiety in their chest. There's a tightness, a heaviness, a pumping heartbeat. Some people feel anxiety in their stomachs. They can feel nauseous. It can impact your intestines. It can impact your stomach in various ways. Anxiety can also be in our head. Sometimes our vision can go blurry, our ears can ring, we can feel like we've got a blocked sensation in our hearing, and we can feel dizzy, we can feel like our mind's really foggy and we can't think very well. So they're just different types of anxiety, different levels of anxiety based on the way we deal with the emotions that come up in different life events. The good thing about anxiety in therapy though is that it's very informative. It lets us know we're on the right track. If someone walks in and sits down and we talk about pizza for 50 minutes, that might be fantastic, but we're not actually getting anywhere. So when I'm seeing people in session and they're coming in talking about what's troubling them, we pay a lot of attention to their anxiety. We make sure it's not going too high. We help regulate their anxiety in certain ways so we can really actually begin to help them process the thoughts and feelings about what they've gone through. So this might then just help give some information about how do we actually understand mental health issues or difficulties. So as I was saying before, I work with people's thoughts, their feelings, track their anxiety, and all these things that lead to behaviours that may or may not help their mental health. So cliche as it is true that our early life experiences do play a big role in how we understand and deal with our emotions. Emotions are the compass of our life. They help us know how to navigate relationships, what we want to strive for, the type of life we want to have, the passions we have, the opinions and ideas that we form. And so as I was saying before, emotions are inbuilt. We all feel them the same way. But what happens is we all have unique experiences in life. Our families, our school experiences, our adolescent experiences. All those experiences play a role in helping us understand how to emotionally deal with things. You know, people know the saying that boys don't cry, girls don't get angry. These are just some very general examples about emotions actually aren't bad. They're all really helpful and important information for us to know. But sometimes the lessons we get taught about emotions can make it hard for us to sit with them and process them. So based on our early life experiences about our emotional needs for relationships, life success, quality of life, etc., then we have stressful life events that happened. And yeah, as I was saying, COVID was huge. Melbourne in particular, and Victoria suffered the most. So everyone's going to experience this stressful life event in a different way. Unfortunately, COVID set the stage for a lot of painful emotions to come up. A lot of sadness, a lot of anger, a lot of guilt. So, and then how we understand how we cope with these things is that the stressful life event plus your early experiences about how to deal with emotions is going to impact us. So perhaps people that have had difficult, lessons about emotions, more likely to get more anxious because COVID really stirred up these feelings. And we, if we kind of reach our threshold of how to deal with these emotions, our anxiety is going to kick in and go, wow, this is really difficult to deal with. And your anxiety is like a warning system going, warning, warning, there's some really painful feelings coming up here that you should be able to have a look at and take a look at. So when we've got this thing happening in our body, we've got our limbic system firing out difficult feelings, we've got our central nervous system like tightening up our body, making us feel nauseous, tight in the chest. We've literally got this battle happening inside us of anxieties and emotions. We try and figure out ways to cope with that. And unfortunately, COVID took a lot of those healthy ones away, as Olivia was saying before. So then often people either just really suffered day in and day out, they had no coping mechanisms, or perhaps even turned to coping mechanisms that made them feel worse rather than better. So that then brings me to the topic of what is depression. As Ben was saying before, depression is not sadness. Sadness is a really helpful emotion. Sadness helps us honour something that's lost. Sadness helps us remember an important connection that we had with someone. If someone, unfortunately, that you loved passed away and you loved them this much, your sadness is going to be equally as palpable. So depression is not a mental health, disorder in some way, and this might be a bit confusing to hear, but it's an inbuilt coping mechanism. So before, when the symptoms of depression were spoken about, where we're feeling worthless, no motivation, we're feeling completely empty inside, really numb inside, that's because we're not feeling any feelings. And this would make sense if you think about depression in a helpful way, in an inbuilt way. If we've got all these feelings coming up from the impact of COVID and they're so hard to deal with, and then we've got anxiety coming through our body and we're dealing with that day in and day out, some part of our mind goes, you know what, this is actually a bit too much. So what I'm going to do is shut down your capacity to feel. The unfortunate part of that is you end up feeling nothing at all. And that, in my understanding, is a lot of what depression is. It makes sense then why you have no motivation to get up and do things, because you're not feeling much inside. It makes sense why you don't really want to connect, because you're not feeling that emotion to drive you forward. It makes sense that it unfortunately leaves you stuck with thoughts of pointlessness and worthlessness. So in some ways, depression, while it is trying to do something helpful for us and not help us suffer with our emotions and anxiety swimming around our body, it unfortunately shuts down emotions. Emotions help drive our behaviour and our zest for life, and so we're not feeling much at all. So I thought I'd finish up with a little bit about how a psychologist can help. So people often come to therapy with an awareness of how they suffer. People come and say, I have panic attacks, I'm eating too much, I'm drinking too much, I'm feeling down, I'm feeling sad. They talk about the ways they suffer, but not what causes it. So the first step of therapy that's going to be helpful for you is to get a real understanding of what leads to your specific suffering. And that's going back to this table here. So having a think about what events have happened in your life that have stirred up difficult feelings that you seem to be really struggling with. And that perhaps what have been some of the early lessons that you've learned about emotions that then make it harder for you to feel certain feelings and work through the emotional impact of something. So that's often the first step that needs to happen. The second step can be, this could be the second step or it could be the third, it doesn't matter. But there's often two ways that we can then do something with this. We can begin to change your unhealthy coping behaviours to healthier ones. So for example, drinking less, doing some mindfulness, paying attention to thoughts that actually kind of might be harsh on your experience. We can work in that way. And that can help. Some people come and go, that's all I need, just give me some better coping strategies that are really starting to feel some relief, and that's enough. And that's completely fine. The third and perhaps most effective step with long-lasting results is to actually work on the emotions themselves. So if we can help you know that it's okay to feel sad and that's not a bad thing, that actually feeling angry in some way might actually be healthy for you to understand that emotion and what it means, because anger just lets us know that something unfair and unjust is happening in our life or towards our loved ones. Then it's unlikely that you're going to feel as anxious. It's unlikely you're going to use unhealthy coping mechanisms, and it's unlikely that our inbuilt coping mechanisms like depression, where our mind shuts down our feelings, are going to kick in. And so then what actually makes psychological therapy effective for you? The relationship is absolutely essential, because if you can work through these things that I'm going to go through now, in some ways it doesn't matter what type of therapy you do, it's going to be quite effective. So what you really need to spend some time thinking about is, do you feel safe enough in the room with the psychologist? And that doesn't mean that it's just nice, warm and fuzzy and you're talking about nice things and general chit chat. It's actually being able to go in there and talk about anything at all, anything about what you're feeling, and to be able to allow yourself to go through those process of those emotions in the room with the psychologist. What's also really important is to consider that you and your psychologist are on the same page and have a really clear understanding of what your actual difficulty is. So for example, you know, if someone came into the room and said, someone that I loved is in hospital with COVID and I'm really concerned, then what are the emotions that are coming up they're struggling with? What's their particular life history that they're struggling in that way with those particular emotions? And then how can we help process those emotions? So we have to understand the psychological problem, the goals of therapy, what are you actually wanting to get out of the sessions based on your internal experiences? And then what do we do together as a partnership to help you reach those goals? What are we actually going to do each session, and how do we track that over time? And then the last, I think, but such important aspect to think about is that you actually work at your pace. So if you're not ready to talk about something, if you're not wanting to think about something, that's actually, there's a reason that that must be happening at that time, and then you might pop it to the side and look at it later. So going into therapy doesn't mean you have to talk about everything. It just means going in there and starting the process and seeing what might work best for you. And I think that's it from me.
Thanks so much, Michelle, for that great insight into your work and also into like opening the discussion on emotions and what they are. And I'd like to invite Olivia back up now, and we'll have a chat about it and answer some questions. So just a reminder to everyone here, you can put your hand up and ask a question. We've got a microphone. And for those with us online, we've got the Slido where you can ask questions. I think, any question that has come up from the talk so far, just chuck it in the Slido and we'll get to it. So one question that's come up is during Olivia's talk, and it said, yes, 5 o'clock wine helped many of us mums get through lockdowns, but what if we're still in that wine o'clock mode after lockdown?
Yeah.
Recommendations.
Yeah. I think it's really, it's really important, and it's the challenging thing with alcohol is that the more that you kind of get into that habit, and it does have some benefits, it's hard to break. So I think the thing that I always start with is, if we're going to be taking something away, what are we going to be replacing it with? Okay, because it's all well and good just to say, well, just drink less, but how do you actually do that? So I know that what a lot of people that I've sort of spoken to have found helpful is that they've actually started swapping out wine, swapping out their regular wine for alcohol-free wine. And you've probably seen in your Facebook feeds, like there's been a huge increase in alcohol-free wines, beers, gins, you name it. So I know a lot of people who've done that. So you still feel like you're drinking something, having something special. You're not just having, water. But that's one way to, I guess, kind of feel a bit of that psychological need, but not having the alcohol as well. And then I think if you're getting that break of the alcohol from your system, you can start to get a bit of distance from it, and then think about what are actually some other things that I can do. And I think also once you take the alcohol out and realise that the alcohol does have a depressant effect, and so it's numbing you out, it's reducing your kind of energy and wanting to do anything other than just flop on the couch after dinner, you might actually notice, I actually have the energy to go for a walk or to read a book or do something a bit more creative. It's actually freeing up time to do something else that actually makes me feel really good, and oh wow, look, I'm sleeping better. I think that can be a simple way to start.
Yeah, I'd really agree with that. I have tried some of those non-alcoholic. Some of them good, some of them aren't as good. What if you are too stuck in your depression to make any changes? For example, we have no motivation to change because your depression has such a big hold on you. Who wants to start off with that? Because I mean, well, maybe because people would often, if someone's stuck in the depression, they might not even go and see their GP. I would think, and it might be, even did you, Olivia, have sometimes, say for example, the partner of someone with depression come in and say, I'm really worried about my wife or husband?
Yeah, I've certainly had that happen, and so then it's about trying to work together to get the person in, and just starting that conversation and trying to just find out what that experience is like for them, and rather than putting what I think they have or their partner thinks they have, just trying to really find out, well, what's it like for you, where you're at the moment, and trying to just, I think all of this, it's trying to instill some hope that you don't have to continue to feel like this. And I think that's where I would probably start having that discussion about medication a little bit earlier for someone who is really depressed. And I've certainly had psychologists get their patients to come and see me because they've kind of, like, they're at a point in the therapy where they just, like, actually you need some more help, and it's not being weak or it's not a cop-out. If you've got really severe biological depression, medication can save your life. So I think that's where the sort of discussion can tend to head.
Yeah. Absolutely. I've even seen people where we hit that stage and they'll get some medication and then their mood starts to lift, and then therapy actually becomes a lot more effective. And they can work really, really well together.
And I think having some of the conversation that we've sort of touched on, like we call it psychoeducation, so just educating people about why they might be feeling this way, and addressing some of that stigma that feeling that way can have. I think educating about what medication can and can't do, since we're talking about medication, dispelling some myths about it, like it's not antidepressants are not something that will make you artificially happy. I think we still don't know very well about how they work, in terms of, like, we know what they do on a certain level, but I think the way that they actually help is a lot more complex than, for example, saying that because people that have depression are not deficient in serotonin, which is, I think, with a lot of the antidepressants, I think that's been sort of simplified a bit, saying it's a chemical imbalance. I mean, there are chemical changes and there are changes in the way the brain functions, but I think what it really is doing is, when it reaches this point that I think the person asking the question is talking about, it can be really hard for that depressed brain to do anything. And using the medication to sort of get some of those areas of the brain that are underactive getting back to a normal state of functioning is sometimes the first thing that you need to do. So how do you help someone that isn't taking the steps to help themselves, even if they have the tools? Which is it's a bit similar to the previous one, but I think what they might be asking about is, I'm not sure about if they have the tools, but someone that's not.
I'm thinking about how important connection is. And I've had experiences where people have come in and friends or families just haven't given up, and given up in terms of just being present. It might just be a check-in. You don't always have to talk about how they're feeling. You don't always have to be there motivating them, but just being there consistently. And it might take time. Remember I was saying, like, therapy only works when you're ready to come and talk, but that doesn't mean that that connection with that person has to stop. So if they're not ready, you can still keep supporting that person, instilling a little bit of hope. But I think it's just the idea that it might not happen straight away, but don't underestimate what it can mean to someone, literally, to give them a call, send them a text, go and knock on their door, to just be there as a friend or family or whoever it is, really, really can make a big difference.
Yeah. And I actually, I don't know how widespread this was, but I was writing a lot of letters during the lockdowns to sort of give people permission to go out and make connection if they were really isolated.
Yeah, I wrote heap as well.
Yeah.
Yeah.
I don't know. I didn't hear of any of them being questioned or anything. But, I mean, there wasn't much guidance around that, but I think that really helped quite a lot of people. Yeah.
And I think sometimes, rather than, I think particularly as doctors, we're very good at telling people what we think you should do to help yourself. And so sometimes turning the question around, and there's the technique of, like, the miracle question, like, if you were to wake up tomorrow morning and your problem has been magically solved and it's gone away, and you wake up and you're feeling just like yourself again, like, imagine that, and how would that feel? And then what's something that you could do that would help you to get to that position? Like, what's one thing that you could do, and give them permission to try and come up with their own solution, just something little, something really, really tiny that they can do that actually feels achievable to them. Because it's no point me giving someone, a list of all of these amazing things that, work and it's going to be so helpful for you if they're not actually invested in it. So, I think, and that talks about, like, if they're tools that other people are given to you and you don't feel any kind of ownership over it, then you're probably not likely to use it. Whereas if like, if I can just do this one thing for me, and I feel really good when I do that, you're probably more likely to follow through.
Yeah. And even though we might talk about general tools and strategies, it's the ones that you end up, like, moulding and adapting that work for you, that might not be in any psychology book anywhere, but because it means something to you, you're going to actually be motivated to do that one thing again. Yeah.
I was thinking about the what we've all talked about, finding a good fit for a certain person, and that I've had quite a few people come and tell me that, no, I've been to see a psychologist, like 2 different ones, and it didn't help. And I think also then when I'll I'll actually ask, well, what did you actually do with the psychologist? And they'll say, oh, like we just chat about like how the week was. And I think that comes back to what you were saying, Michelle, about having a focus for what you want to work on and being really clear about what the goals are. Because, and that was also something I wanted to talk about, was the frequency of therapy, because I think people that have had found psychology not helpful, I'll say, well, how often are you seeing them? They'll say like once every 2 months, and I'm sort of like, well, how much momentum and kind of what can happen in between, because so much happens in 2 months that you might end up just chatting about what's happened in the last 2 months and not get anything moving.
Yeah. This might be an interesting analogy, but I often describe psychological therapy as if you were going to the physio. So you go there, you have a think about what the problem is. Your pain might be here, but it's actually being caused by something in another area. So the physio might say to you, okay, we understand what the problem is. You've got this pain here, but there's something going on in your muscle there, or something that's causing this pain down there. What we're going to do is you're going to go home, ice it, and do these strategies in order to alleviate the symptoms. But then I need you to come back every so often, weekly or whatever, because we really need to deal with this issue here so that you don't keep getting the pain down there. But I need you to come every second day, every third day, every week, because if we don't do it at that frequency, this is going to just flare up again and cause you pain. And so I think that is a really important thing to think about with psychology, and it can vary, often weekly or fortnightly. It works pretty well. But if you think about it, you might have some relief or some insights or some changes that happen in session, but because of either how long lockdown's lasting, based on how you've been taught to cope and deal with things, after 3 or 4 days, the old coping unhealthy mechanisms of depression might kick in again. And so you actually need a frequency in order to kind of build up the healthy coping mechanisms, process what's been emotionally difficult, and that can be weekly or fortnightly to actually really get some momentum going. And really checking in at the end of each session, okay, based on today, what have I learned? What do I want to implement between now and next session? How is what we spoke about today actually helping me achieve those goals? It's really important that those conversations happen at the end of pretty much every session. Because otherwise you could just come and have a nice chat, and that might feel nice, but you're actually not making any changes. Yeah.
I was interested, Olivia, that you brought up the Head to Health hubs, because I actually only heard about them like about 6 months ago.
Yeah.
I didn't know that they were around. So what's your experience been of that?
So look, it was, I don't know how well utilised it was, and I think one of the problems with these things, it actually sounded like a really great service. So the idea is that you ring this number and then you kind of speak to someone about what's going on, and then they triage you and let you know, okay, well look, we think that this is sort of where you are and this is what we think is good for you. And that may be if your distress was sort of very high, and they were very concerned, and that would mean that you'd be able to access like a psychologist or psychiatrist through the service. But the problem was, again, for a lot of people in the middle who kind of weren't bad enough to need that level, and kind of like, well, yes, you should see a psychologist, you'd really benefit from that. Then the issue that we were having, which was already an issue before COVID, was trying to get in to see a psychologist. And also, yes, the sessions on the mental health care plan went up to 20, which is great, but there's generally still an out-of-pocket, and that's another really big issue that I didn't really address, but there are a lot of people for whom they can't even afford that out-of-pocket to see someone, and then once the 20 sessions are over and you don't get that rebate, they can't access it. So again, it's just sort of what I was talking about, and there are a lot of patients that I would see that just would not have a bar of seeing a psychologist, but would happily have a phone appointment with me, once a week to check in, or once a fortnight, to just have that experience that there is someone there that I can talk to, that cares, that's going to listen, that understands a bit of what I'm going through. So I think it's a great idea. I don't know how much, I guess I just bring it back to if we could just somehow increase that funding to GPs, I think to provide better mental health care to our patients, I think that would be a really good use of funding. Yeah.
Just picking up on something that you talked about, Michelle, that depression is more of a shutdown of emotions. I think something that, and I don't know how much you go into this with your patients, is about, that got me thinking about that this is not like a, when you're explaining what happens, it sort of seemed like almost that the person chose to shut down their emotions, but it's automatic and unconscious, right?
Yeah, absolutely. It's not you wake up and go, okay, today I'm shutting down some feelings. It literally just happens. There's mechanisms in your brain that stop and start up different neural firings from your brain into your body. Just like those pictures I showed at the start, that back part of the brain sends literally neurons into your body and activates different parts of your body. That's called a feeling, hence why they're called feelings. And then, we put certain labels on those emotions. Yeah.
Because I think that comes back to what I was saying about that. I think some people think that it's not valid if there's not a reason, and while that a lot of the reason can take quite a long time to sort out. Like, how long does it take you, Michelle, sometimes to get through that first phase and then start to get into that safe space where people can start talking about things?
That's a really good question, and there's actually a lot of research out there that psychologists and then the people that they see have a real mismatch, where sometimes we think, oh, something's working really well, and then the client will be like, nah, it didn't really work really well. Hence why there's something really important about always this discussion about, are we on the same page? Are we working towards the same goal? But yeah, we've actually been asking the people that come through our door that question, because as psychologists we're like, 1 to 2 sessions and they're feeling a bit safe, but people have come back to us and said at least 6 to 8 sessions before they really feel they can begin to talk about the things that might be really hard to speak about, whatever that might be. Yeah.
I've got a question here. Any recommendations for self-assessments to identify anxiety or depression?
So I think that's where websites like Beyond Blue and the Black Dog Institute are a really good place to start. So they have online self-assessments that you can do. Yeah.
A real common one is the depression, anxiety, stress scale, and it just has about, I think the short version's about 21 questions, and it's just your experiences, and then you can even add them up yourself, and it gives you just a little bit of an indicator of where your mood is, where your anxiety levels are, and where your stress levels are. And that's a really quick go-to. Yeah.
Speaking of rating scales, I recently did some, I'm not sure the exact rating scale that it was, but it was about stressful life events and how that can increase your risk of developing a mental health problem at any one time. So I was sort of trying to explain to some parents about why their sort of adolescent might be going through certain things and why maybe reducing the amount of stress might be helpful. It was really interesting what was on there. Like, the really high scoring ones were obviously things like death of a spouse or things like that, but even things like positive things like finishing your degree or something can be actually associated with well-being. Because I think not all stress is bad, but as in like you need stress to have meaning to your life a lot of the time, I think. But yeah, that some things that are seen as, you know, as positive, or for example, selling your house, like it's,
Yeah.
or buying a house, like it's, it seems like a good thing, but that doesn't mean that it's not stressful and doesn't put a burden on you. I think some people think that, well, that's not really something that should cause me to feel bad because it's a thing that I want to do. That doesn't mean that it's not difficult. What are some simple tools that one can do when they're feeling anxious? We were going to talk about mindfulness, but also I'm sure Michelle has some more in her toolbox as well. But
Yeah. We're happy to talk a bit about mindfulness because people often hear about it as some kind of formal practice, and that is fantastic to actually do. But if we just think about mindfulness, any time we begin to pay attention to what's happening inside us is us being mindful. So, you know, the thoughts that we're having, the feelings that are coming up, the body sensations. So there is actually a really good website. I think it's called the Free Mindfulness Project, and they've got some quite really good formal mindful practices. Some are 4 minutes, some are up to 45 minutes or so. And the audios are there, and you can just press play and do those ones. In terms of, I guess, regulating anxiety, there's quite a few things you can do. Breathing, as much as people talk about it, but breathing in certain ways actually does, like, let your central nervous system know, you know, it's not that bad, it's an emotion, I can calm down. And then by breathing in certain ways, you're actually helping your central nervous system not be so activated, not being in that kind of tense or fight or flight mode. Using your 5 senses is a really, really good way to deal with really high anxiety, like dizziness, or if your eyesight and hearing get affected, because essentially what's happening, the mind's going, oh, this is all too much, this is all too emotional for me, I can't deal with this. And so the mind just goes, well, if I just kind of blip you out, and you don't have to feel your feelings, you don't have to know what's happening in your environment. It's like trying to protect you. So using your 5 senses helps your thinking brain switch back on, and then you'll feel less dizzy, you'll feel more connected to yourself, and you'll feel less anxious. Yeah.
What about those weighted blankets and things like that?
I've had a lot of people find them really, really helpful. And Udis, I think a lot of people love that. That really comforting feeling of like a, you know, warm hug from an Udi. Yeah.
Yeah, I actually had a hoodie on the other night, and for some reason it was just that particular hoodie, but it made me feel really sort of relaxed. I don't know why. And there's a lot of those, what are those toys out of like the fidget things with the,
fidget spinners and those squishy kind of balls. I'm not sure what's in them, but they're really cool.
Another thing I think that can be like a really good, I think what you were saying about mindfully doing things like dishes and things, but also, for example, like if you get herbal tea, if you kind of do it in a mindful way and like smell the tea, like measure it out, and not be, for example, on your phone while you're drinking it.
Yeah.
Like that.
I think just giving yourself permission to have a break from technology, social media, those sort of things. Yeah.
So for those who don't have a diagnosis of anxiety or depression, what could be key signs to look out for? Maybe they're asking, I'm not sure if they're asking about in someone else or in themselves. I think what you were saying about those, if you're wondering about those resources that you mentioned,
Yes,
are great.
I think the self-assessment, or you know, if you're someone who tends to experience things in your body a lot and you have a lot of kind of physical symptoms, but you keep going to the doctor and you know, actually everything looks good and physically, you know, it's not to say that you're not feeling those experiences, but maybe just to start thinking about, oh, could there be something else that's going on? You know, is this maybe related to my mental health, and just kind of, you know, being open, I guess, to thinking about it in that way. Yeah.
With the nutrition side of things, I think probably about 10 years ago I got interested in some research about depression in particular, but also anxiety being an inflammatory condition.
Yeah.
And I'm not sure about how that lines up with other inflammatory conditions and the diet for those.
Yeah, and I think that's really interesting, and I think we're seeing that coming out a lot with long COVID and the rates of depression, and there's a lot of evidence to show that you know, depression can also be an inflammatory process, so post-viral can cause contribute to depression, and then there's a lot of people who find that certain foods can be inflammatory for them as well, so that's the kind of the basis behind like a lot of the anti-inflammatory diets as well. So, you know, often it's the more refined foods, the refined sugars, the white flours, but even for some people like the nightshade vegetables, so they're all the things that are grown from flowers, so capsicum and you know, even cucumbers, those tomatoes, those sorts of things can be quite inflammatory for some people. The other thing that I forgot to mention, and I'll just quickly mention as well, is the importance of salt, which I forgot to include that in my list of nutrition, but particularly for anxiety as well, that a lot of us tend to be salt deficient because we're sort of been grown up with this low salt mentality. And I think it's important to realise that the research that was done on sodium and salt restriction was mainly in men and men with high blood pressure, and even then the best evidence showed that it only was important for about 50% of men with high blood pressure, and there was never really any good evidence for women and children showing that they would benefit from a low salt diet. And salt deficiency can make anxiety worse, panic attacks worse, and if you go put someone onto an antidepressant medication, that also lowers your salt levels as well. So that's just and if you're eating more real, whole, natural foods, due to the change in mineral content in the soil, there's not as much sodium in the soil. So you really, if you're craving salt, if you crave salty foods, that's a sign that you need more salt. And I've just had even, and that can help with a lot of the physical things like the dizziness and palpitations and those sorts of things. So yeah. So I think there's more is going to emerge in the role of diet, inflammation, and mental health. Yeah.
What about there's a lot of people that are going on to low FODMAP these days. I don't know what that's about. Can you tell me?
That is more about like in terms of irritable bowel, and that's another thing that was something that just in terms of general practice, you see a lot of people with bowel issues, and so that's the FODMAP. So there's certain things like fructose, and I can't remember all the different things that it stands for, but one of the key things with that is that you sort of remove those foods, and then you need to gradually reintroduce them with a dietitian to then see what you can tolerate. Because if you continue to just exclude all of those foods, then you'll have a very restricted diet, but then when you do try and reintroduce them, you're going to have an even worse reaction. So, yeah.
And I noticed when you put up the generalised anxiety disorder slide that a lot of anxiety and depression and other mental health symptoms can be expressed in bodily sensations. And I see a lot of patients whose main presenting problem is like chronic pain. And that it's a really hard one to talk to patients about, because then if you start even suggesting that there could be a psychological element to it. It's that you're saying that you know, like it's in your head and it's not a real symptom.
Yeah.
I don't know. I assume you've seen quite a lot of that in general practice.
Yeah.
Yeah.
Yeah, and it actually is a real symptom, because if you think about, if you're feeling anxious, your body's tense for prolonged periods of time, because anxiety can just stay in your body for as long as it needs to, then that's going to actually cause some issues with prolonged tension in your body from anxiety. Yeah, and the pain's real. It's just the cause might not be medically understood. It could be how long anxiety's been sitting in your body, or how, you know, your stomach. It can even affect your stomach and upset your stomach in significant ways.
Yeah.
Yeah, and it is based on the central nervous system, which is where we feel anxiety.
And I think it's also one of those things, it's your perception of the pain and then the feelings that you sort of associate with that. And, you know, if you're scared of it or don't acknowledge it, or, you know, if there's other things that are going on that are unacknowledged, I think that, you know, that will make the pain worse. And, you know, I think that that's where things like meditation and mindfulness can actually help train you to pay less attention to the pain and kind of create like a little bit of a mental safe space from the pain. Yeah, yeah.
I've got another question here. How do we approach the stigma around medication for mental health illness?
I might speak to that, because there is a big stigma, and there are a lot of people who are very opposed to medication. And again, I think that's why it's not something that I try and force onto people. It's an interesting thing as a GP that you come to learn over time that a lot of the prescriptions that you give to people never actually get filled. So again, it's that whole thing of like, I can write as many scripts for antidepressants as I want, but it doesn't mean that they're actually going to get taken. So again, I think it's about having that discussion, as you say, what they can do, what they can't do, that yes, all medications have side effects, and these are the side effects that you can expect, and this is why they happen, and this is what we can do to try and make that be less of a problem for you. You know, maybe we need to start really, really low and increase the dose very, very slowly and keep checking in. But I think the more information you give to someone, and also, as you say, it's not a magic fix. If there's all of these other unresolved emotional things or losses or other things, like that all needs to be addressed too. But to keep in mind that it can take at least 2 weeks, and it's usually more 4 to 6 weeks to see a benefit, and that's 4 to 6 weeks of taking it every day at an appropriate dose. So I think often what I'll see is people will, you know, they're not that convinced that they even need it or want to take it. They're not really on board with it. So then when they start getting side effects or it doesn't work immediately, the temptation is just to stop it. So I think it's really about trying to have that discussion, you know, that education, and that it's something that you're both agreeing that, you know, we actually, these are all the reasons why we're using it. And I think a lot of people say they're worried they're going to get dependent on it, or that it's addictive. And I kind of use the analogy, it's the same if I'm starting someone on medication for their blood pressure or diabetes, which are all conditions which you can improve with lifestyle as well. But sometimes if your blood sugars are really high and your blood pressure is sky high, you're at massive risk of having a stroke, the best and safest thing that we can do is use medication to control it. If you're doing all of those other lifestyle things in the background, great. And then, you know, over time, you may not need the medication anymore. And it's the same thing with antidepressants. You know, you kind of use them for a period of time. When you're back to feeling like yourself again, and we can start thinking about, well, when's it time to start reducing it? You know, keeping them on for maybe 3 to 6 months to try and reduce the risk of having another episode of depression. But then you're not going to be on it forever, and then we can talk about, you know, slowly reducing and coming off it. So, yeah.
And doing, getting the benefit from the medication, I think in order to come off it, you sort of need to work out, well, what happened, why did I get depressed, and make those changes before you come off the medication. Because if you come off it and you've still got the same stresses or you've still got the same issues, then it's likely to go back again. I think also timing coming off medication, like not to do it when you're under stress. Or,
Yeah.
I think sometimes there's an urgency for people that they feel to get off it, which is understandable, especially if there's side effects. But I think like careful planning of it is really important. The other thing about medication that I say is that if this isn't really talking to stigma necessarily, but a lot of people do have those worries about being addicted to it or dependent on it, or they're worried about, well, what are the sort of theoretical long-term effects of them? But actually we sort of know that depression itself and anxiety is actually, like, there's evidence that it's toxic to the brain. If it's inflammatory, it's actually causing damage, and we know also that the more depressive episodes that you have, the more likely you are to have more. So I sort of talk to patients about, well, there's not really evidence that they cause long-term damage, but we know that if we don't treat this, then there will be sort of negative consequences. What about just talking about medication? I think people would be interested in what are some of the common side effects. I mean, the most common that I see are sexual side effects.
Yeah.
And there are some newer medications out that don't have as big an impact on that, but it can be hard to talk about. I don't know if is it something that you would always talk to patients about?
It's certainly something that I bring up, and there's a lot of really good tables and tools that you can show, this one compared to that one. And I think in terms of the sexual side effects, a lot of people, when they're very depressed or very anxious, they're not really interested in that side of things anyway. So it can actually, they're kind of like, I just want to feel better. But a lot of them, for some of them, it can actually cause problems sleeping. So then it's like, well, if it's keeping you awake at night, then we'll change to taking it in the morning. If it's making you really sleepy and drowsy, then we can take it in the evening. And a lot of the things that some people can feel kind of dizzy, headaches, nauseous, those sorts of things. Again, increasing salt, making sure that people are having enough fluids, all of those sort of things. Yeah.
The other one that I see is that initially it's good, it gets them out of their depression, but then they have what I think some of the literature calls antidepressant-induced emotional blunting, so not being able to feel emotions that that they want to feel. For example, if something's sad and they find that they can't cry, or Michelle, do you see patients that are on medication that have that kind of problem?
And come in and it is actually like a blunting and a numbingness, or a numbness that they even can feel the urge that something emotional wants to come up, but it doesn't actually then get expressed.
How do you manage those side effects of someone not taking their medication? I wonder if they're asking about if they are on the medication and they start missing doses, which then I think people think that because there's a difference. The reason we say that their antidepressants are not addictive is that yes, they cause what we don't call them withdrawal symptoms because it's a bit technical, but it's patients will get, if you don't wean it down slowly, they'll get feelings like restlessness, agitation, some people describe sort of brain zaps. And people can, there's a couple of ways people interpret that. I think some people think that, well, I am addicted to it, I need to go back on it. or some people actually think that when they stopped taking it, they were feeling bad because they need the medication, but that's also not right, because I think that's an opportunity for me to say that the medication doesn't help when it's sort of just because it's in your body. It's actually the changes that it causes in your brain by taking it every day. And when you stop taking medication, that's why you might not, if you do need it, you might not relapse for a number of months, because the brain takes a while to change back. So I guess the other thing that the person could be asking is, how do you help someone that is having problem maybe remembering to take their medication, or I mean, Olivia, you'd have lots of stories of people not taking their medication.
Yes.
That's not just as mental health medications, but
just
physical.
medication in general. Yeah, absolutely.
I think there's like lots of strategies that you can use, like putting it next to your toothbrush, or these days like alarms.
Yeah, I think there's a lot of apps out there, medication reminder apps. Some people find having like their own little dosette box that with the days of the week, and just that reminder to take it every day. But yeah, I know myself, I'm terrible if I'm the worst person if I'm on antibiotics. I forget half the doses, so it's really easily done.
See what else. One thing that from, not sure if it was Olivia or Michelle, that people expressing that they feel guilty that other people have it worse than them, and like, why am I entitled to feel depressed when, for example, there's refugees in refugee camps or things like that. And I think it's sort of it tends to stop them actually thinking about what's going on for them, and I think it is important to have gratitude for your to the position you're in, but I think in those situations it's not a helpful way to think, and I'm wondering how both of you sort of tackle that, because it's a difficult thing to talk about, because you on the one hand, you've got a point, but it's sort of not helping you.
Yeah, I guess we just, rather than trying, sometimes I guess we can talk about challenging that thought and thinking about and understanding what's happening for you in a more compassionate way. But sometimes it's also really helpful to think about exactly what you said, Ben, that does this thought actually make you more depressed? Does this thought actually take you away from not being connected and mindful with yourself? Because if that thought comes in and says, well, I don't have a right to feel depressed because someone else is worse off than me, even though that might be true, it stops you from actually being really compassionate and caring and pausing and being mindful and checking in with yourself.
I actually heard a great podcast on this very topic during one of my lockdown walks, and I can't remember who it was, but he was sort of saying that this whole idea, well, if others have it worse and I have no right, that it sort of suggests that like there's somehow some limit on compassion or empathy, and that you're only entitled to an allotted amount, and which is it's not the case at all. Whether you have big trauma with a capital T or small trauma, the trauma of everything that we went through with the pandemic and lockdown, or there may even just be not even that, things that happened when you were a child that affects your ability to recognise and sit with uncomfortable emotions. there's no limit to the amount of empathy that's available to you. You know, if it's a problem to you, if it's affecting your mental health, if you are feeling that way, it's still a problem. So it's you know, guilt really shouldn't come into it, and it's such a useless emotion. It doesn't serve us in any way. You know, that's that same thing of that should mentality. It says who, you know, and I think you're right, it's that self-compassion that, yeah. And it really helps.
We've got a great question here. How should those on anxiety medication approach pregnancy and starting a family? I can talk a bit about it, and I'm sure you can as well. Yeah, it's a really important question because I think what has to be weighed up is what are the risks of coming off your medication while you're pregnant, and what are the risks to the fetus, so the developing fetus. Some medications are worse than others, and there's really good information, long-term studies that you know, your doctor will have access to about what are the actual risks of each medication. And there's certainly some that I would say to come off, but generally the modern antidepressants, apart from one like paroxetine, which has had some studies where there were some adverse outcomes, usually if you've been on them for a long time and you've needed them, pregnancy is not usually a good time to come off them, because there's a greater risk of developing depression and anxiety during pregnancy. But you've also got to be respectful that people may not want to be on medication while they're pregnant. You can only really give them all the information that they need to make like an informed decision.
Yeah. And I think that comes into it, you know, when you're having that conversation about one to start on, if it is a woman who, you know, that's a possibility that she's going to want to start a family or may become pregnant, you're right, you know, it steers you towards, you know, well, these are the ones that we know are safe and have the best evidence that can be used in pregnancy. These are the ones that we would avoid. But I think you're right that that the most important thing is to make sure that your anxiety or depression is well managed, because pregnancy is a stressful time, having a newborn baby is a stressful time. You know, there's the risk of postnatal depression, but there's a lot of good services, you know, through, you know, with maternity services, if you have a history of a mental illness and you do choose to, you know, wean and come off medication, that they'll keep kind of checking in and whether you need to restart something or not. Yeah.
There's, and especially if you have quite a severe anxiety disorder, there's even in the public system, like at the Royal Women's, there's there's a service to have closer monitoring of your pregnancy.
Yep, definitely.
This is quite a complex question. Is there a reason that some people suffer from anxiety or depression and others don't? Can it run in the family? Just to start off, the question that I always ask is like, can it run in the family? Yes, it can, but is that genetics, or is it the dynamics in the family, or is it I mean, there's a lot of research now on intergenerational trauma, so it's not as simple as nature versus nurture. I think it's really complex, but then the person asking the question is right, that there are some people that seem to have similar stresses but don't develop these illnesses, but then everyone has such a unique... that was another point I was going to make also, was when you put up your slide, Michelle, about you know, early life experiences and those early relationships. I think it's a really hard one to start talking about with people, because a lot of people that actually had quite things that contributed to their later mental health problems, they actually initially see their childhood as like amazing and very rosy. And that's not to say that it wasn't, but they just did some of the things that contributed to them developing mental health problems were not really apparent. And I think it's really important to get away from blaming, because then I think patients can think, oh, you're blaming my parents, or whereas the parents, I'm sure they, like most parents, try to do the best that they can, but they do have their own issues that they bring to their children. So.
Yeah. We always talk about good enough parenting where, you know, they're going to do things that really help and work, and we're going to do things that are not. And it's just an inevitable reality that, you know, we do the best we can, and sometimes things get delivered the wrong way, or, yeah.
Okay. We're just about out of time. I'd like to thank Michelle and Olivia for generously preparing their talks. They put a lot of effort into preparing it, and so generous, and they were really excited that I asked them to speak. And I think it is good to sometimes reflect, you know, when you're doing clinical work day in, day out. And it's been really good to share this night with you and to talk about this together. I'd like to thank Westgate Health Co-op and the grant that they received from the Westgate Tunnel project, allowing us to run these forums. I think Bev's going to come up and close for us tonight.
Thank you for attending the Westgate Community Health Mental Forum. We always welcome your feedback, which will help us improve for future forums. For those of you online, you will see a link posted in the chat with a link to our survey, and for those in person, you can scan the QR code on the projector. As this will be Ben's last forum as he heads off overseas, we'd like to thank him for what's been an enormous contribution to these, putting these forums together. He's crystallised a thought bubble into a series of forums with great guest speakers that's been open in a local community setting, which has just been fantastic. It would also be remiss of us to not acknowledge the work behind the scenes. Behind every great man, there's a woman, and his wife Jenna did a power of work, especially in those early days of making these sessions come alive. So I'd like to acknowledge Jenna for her role in making it all happen. So thank you, and we'd just like to leave you with each of you a way to say thank you. So
Thanks so much.
safe travels, and thank you.
Thank you.